Hi everyone. So Kiarmin and I work really closely in the work that we do. So there's 2 more presentations, and we're both going to do like 1.5 of each of the rest of the presentations. The next presentation is Kiarmin's presentation featuring Darren, and then my presentation is Darren featuring Kiarmin. And so that's why we're both up here.
Thank you, Darren. Yeah, I'll
Okay.
come over here. Yeah. Thank you, Darren. Thank you, Sarah, for introducing us. So, like Sarah said, I'm a program coordinator for a project called Advanced Alliance at HIM. And what the Advanced Alliance allows us to do is to do more of what we do on a larger scope and expand the populations that we serve. The reason I say this is the project that we're talking about is part of that and is related to other organizations that we're in alliance with. So over the course of the summit, you may have seen diligent note-takers participating in each session and record presentations. So these are rapporteurs from all over Canada, sponsored by organizations in the Advanced Alliance, HIM, CBRC, Max Ottawa, ACT, and Réseau. There are a handful from BC specifically, and those from BC are part of the BC Community Advocates Program. Oh.
They're mostly at this table right here.
Yes. But note-taking is not all that they do. They do more, and we will get to what they do in this presentation.
So the BC program is a joint initiative between the Health Initiative for Men and CBRC. BC aims to build capacity and to engage community members to address rural and small urban LGBTQ community needs by centering community assets. We sponsor LGBTQ individuals from small urban or rural areas across BC in an effort to address geographical barriers that those of us in Vancouver only hear about but don't personally experience when we talk about limited resources for our communities. was born out of decades-long tradition of minority LGBTQ communities responding to collectively experienced oppression in urban areas by mobilizing communities from within, and we aim to empower communities across BC in rural and small urban settings. Is our slides working?
I think they are, but yeah. So this is the second year that we're bringing folks from for They were here last year, and we're happy to host another cohort this year. So we aim to empower communities across BC using a community-centered approach. And we know that community members know what the needs and challenges of their community are the best. And to create long-lasting and sustainable change, it needs to come from community. So the key here is to provide communities with the tools necessary as opposed to providing outsider services that are dependent on professional organizations.
Cool. And so again, one of the main pieces that we come across a lot in our work is that LGBTQ health information, resources, and discussions happen a lot in urban settings, but not quite so much in rural or small urban areas. And so to overcome this geographical barrier, we prioritize expanding the summit participation beyond for folks in Vancouver, providing training in health promotion, knowledge translation, and exchange, and by providing an opportunity for networking and collaboration among BC participants.
BC participants take part in training workshops that are provided and tailored health promotion tools and guides. And they also attend the summit, the programs around the summit, and this allows participants for different parts of BC to connect with each other and share knowledge and resources that often help inspire each other's local efforts. HIM and CBRC further empower BC participants by connecting them to their local LGBTQ organizations when they exist and providing guidance on identifying community assets and health promotion that works for their communities. So we say we take a community-centered approach, and what we mean by that is there are 4 different components. First one is strengthening communities. So we take a asset-based approach to community work, and this approach suggests that community-level outcomes happen as involvement deepens, and community members build social action independent of professional services. Asset-based methods include tapping into local system, looking into what's already there, and giving members the tools necessary to organize and form social networks. We aim to provide training in outreach and community work strategies in our program, and thus increasing the capacity of participants to be involved in their communities. The second point to this approach is the volunteer and peer roles, so essentially creating community ambassadors in the community. This follows a peer support model and peer-based interventions, and enhancing individuals' capabilities to provide advice and education to their peers. Our goal is that the participants return to their home communities and be seen as active leaders amongst their peers, and this involvement is an effective community-level method of knowledge translation and community mobilization. The third one is collaborations and partnerships. As we mentioned before, one of the things that we do is connect participants with organizations that do GBT2Q work when in their communities. And these organizations may not be GBT2Q specific, but often are adjacent to GBT2Q Health, such as Positive Living North in Prince George and Living Positive Resource Center in Kelowna. An important component of this program is opportunity for networking and synergy among like-minded people. And a desired outcome would be forming coalitions and improvement to local services. Lastly, it is access to community resources. So reducing barriers to participation is significant. So widening access to participation by connecting them to resources. So for example, providing them with the strategies to acquire sponsorship. So we are providing this year's participants with an outreach guide that includes a step-by-step how to contact businesses and organizations for sponsorship in your community. So that's an example of creating access to community resources.
This wonderful graphic here is an overview of where our participants from last year's cohort were sponsored from. Kim Kinnikin, who's actually in this room, who worked with us previously, was very pivotal when it came to the diverse recruitment of guys that were able to come last year. So thank you, Kim, for that. Through the help of Kim and his work, we did intentional recruitment using our gbMSM network to make sure that we got participants, as you can see, from each region outside of Vancouver Coastal, which are the Fraser Health Region, Northern, Interior, and Island Region. We were able to recruit participants from as far north as Prince George and Anaheim Lake to Victoria to come to Vancouver to participate in CAMA and Summit. We prioritize participants who are eager to become more involved in their communities, because a large part of what we hope for participants involved was the sharing of information back into their home communities. We try to adopt a health equity lens by prioritizing and centering members of communities who faced unmet needs and health inequities. Participants were connected within networks, and participants who were connected within networks of their communities as well.
So a little bit about the program. So the roles of the participants involve attending and responsibilities is attending a pre-summit webinar that is regarding introductions. Can you guys hear me okay? Okay. Introductions, overview of the summit, and overview of a KTE activity, so knowledge translation. The second one was attending the summit and repertorying at least 2 sessions with provided templates and taking highlights of each session. Participating in lunches and dinners and building relationships with each other and professionals in the field, and developing a KTE product and deliverable to share in their communities. And then lastly, it is attending a post-summit webinar where we talk about the KTE product more and talk about the reflections and takeaways of the summit and experience in Vancouver.
And so these are the outcomes of the programs outlined on 3 levels: organizationally for the participants and then for their communities. Organizationally for CBRC and for him, we at the very least get rapporteurs for the summit, but also an opportunity to facilitate capacity building for the participants and network building between us and the communities. For our participants, they receive outreach training via a step-by-step outreach guide developed by the Health Initiative for Men to help our participants do outreach for LGBTQ health in their respective communities. And the outcome for the communities is then health promotion, since not only do we get participants returning to their home communities acting as health ambassadors, they also are partaking in the knowledge translation and exchange between their communities and us, the organizations operating outside of Vancouver. And then we as CBRC and him become better connected to these communities and vice versa.
Okay. So this is the photo of last year's participants. Some of them are in the room right now. So last year's participants reported their experience to be rewarding and inspiring. They left with a renewed passion to do community work, and the topics discussed, specifically mental health disparities, which was the theme of last year's summit, among LGBTQ communities, resonated with their experiences and observations of their communities. Patrick, a former participant who is now well connected with us, said that his volunteering became a paying job, and he has continued to do work as a registered nurse in mental health and addiction services in his community. And he references a session about crystal meth use in queer communities in last year's summit by Vincent Fancor. I don't know if you're in the room. No, you are not. For steering of his career and where he is now. We're very excited to continue to engage with communities across BC and support community action and mobilization, recognizing that some initiatives that may work in urban settings like Vancouver aren't necessarily scalable in other areas. And that is why we take an approach that centers communities in advocating for their own health and well-being. And that is us. Thank you.
Can we switch? Yes, thank you. Thanks. Okay, so now I'm gonna switch gears for a bit and talk about the work that we're doing at CBRC as part of the gbMSM Health Network. And so I'll just be giving kind of a brief overview. And of course, as we all know, gbMSM stands for gay, bisexual, and other men who have sex with men. And so what is the gbMSM Health Network? This thing that I am the manager of that I have to explain every time someone asks me, what do you do, Darren? What is your job? And I go, oh, well, the gbMSM Health Network, don't you know about it? And it's a bit hard to explain because we do a lot of things, but this is a bit of the background. This program was developed as a response to the Provincial Health Officer's Report, HIV Stigma and Society, published in 2014. Dr. Mark Gilbert at BC CDC wrote this report along with contributions from CBRC and a number of community organizations and members in our sector. When I first got hired for this job, I was told, Darren, this is going to be your Bible, so treat this like your Bible when you're doing your work. So this report provided an overview of what HIV prevention was like in BC for gay men and outlined recommendations on how we can advance HIV work in BC to be more effective and meaningful. So these are the priorities. One, to develop a comprehensive provincial health strategy for gbMSM, better provincial sexual health education strategy in schools, scaling up access to HIV and STI prevention and treatment, scale up access and competency in areas of mental health and substance use, combat prosecutorial guidelines for HIV criminalization, and increase research and surveillance and data. So these recommendations include policy-level strategies, structural and behavioral change, and community-level involvement. They're ambitious recommendations that require province-wide coordination of government and community-led programs, and implementing these recommendations will require, or have required, strategic planning with key stakeholders and decision makers. In doing this work, we consider the extensive knowledge already acquired within communities. We value a combination approaches that build upon the work of local organizations and public health programs while creating stronger provincial partnerships to increase service delivery to increase the health outcomes of gbMSM. And my work in this largely is funded by the PHSA, Public Health Services Authority. The work that the network does can be categorized into 3 pillars, and so this is knowledge translation, capacity building, and advocacy. So now I'll go through just briefly some of the work that has been happening as part of the gbMSM Health Network. Recently, we developed some progress cards based on the different health regions of BC. And so this past year, we've updated our regional health reports, also known as the progress cards. These are now a quick 3-page report summary that provides just an overview of the gbMSM population in each geographical health region in BC. And these reports present stats compiled from various sources, including the Sex Now survey, the BC CDC, and stats from BC CFE. They provide a snapshot for service providers, policymakers, and community members to add context and to help support the work in bettering the lives of gbMSM in BC. So one of the first stats that people see when we show these reports is an estimation of how many gbMSM are in each specific region, or like approximately. That's because outside of Metro Vancouver, we often hear from potential funders and people that there's just no gay men in the area to serve. So this is a simple resource that not only shows the stats of maybe how many gbMSM do exist in the area, but also shows stats like how many of us are out to our doctors and also how well we're doing according to the HIV cascade of care per each region. These reports are up on our website, but I also have some physical copies I can get to you if you're interested. Nate mentioned the CBD course that UBC developed. So this was launched in partnership with CBRC and UBC the year prior. And so this year we've been working on updating this module based on the feedback that we've gotten. The feedback that we've gotten was that this module for care providers could be more trans and two-spirit inclusive. So we've been working with folks from PRISM and Indigenous consultants in this revision process. So just as a reminder, this is a course that's really just like an introduction to gbMSM health issues and implications. It was designed in partnership with all of the regional health authorities, Providence Healthcare, Health Initiative for Men, and CBRC, and the update of this CBD course is currently still in the works. HIV Healing Inner Voices is a short film on the impacts of HIV stigma on Indigenous communities, specifically 8 individuals living with HIV. I really, really wish that I could have shown you this film at the summit, but the filmmaker behind this, Martin Warburg, has grand plans to showcase this film at film festivals. So his production company has put some restrictions on it being released to the public so that it can qualify for film festivals. CBRC's role in developing this film was that we helped Martin get funds through PHSA's innovation funds to produce this film because we really believed in Martin's vision and ability to create HIV educational tools that are culturally relevant, grounded, and very moving, which is exactly what this 20-minute short film does, which I'm very lucky that I was able to see, and I got the pleasure of seeing it. And so I'm hoping the coming months we'll be able to screen it for everyone in some capacity. VPOS, Vancouver Islands people living with AIDS and HIV Society, also contributed to the support and to the funds of this project. This year, CBRC was also successful in our application to PHSA's Innovation Funds, where we applied for funds to create this new position that Jody mentioned yesterday morning. This is the Indigenous and Two-Spirit Health Promotion Lead. Some of you may have already met and chatted with Glenn Saze, who's pictured here, who's been hired in this role. This position came out of many conversations that we had with our Indigenous partners, namely Harlan Pruden and our colleagues at the Metro Vancouver Aboriginal Executive Council. We realized that we needed someone at CBRC who could do work in an official capacity, not just off the side of their desk, on health promotion in Indigenous communities with a focus on Two-Spirit and gbMSM. So as Glenn is just starting this role, we're really excited to continue working with NVAC and the First Nations Health Authority to make sure that we're all doing all that we can in bridging the gap between the queer men's health sector and First Nations communities. So one of the things that Glenn will be working with us to develop, along with Harlan Pruden at BCCC, is this PrEP access resource for Indigenous folks in BC, as a response to the fact that when PrEP was first available for First Nations communities in BC prior to the 2018 provincial coverage, there was very low uptake because we as a community failed to let Indigenous communities know that PrEP was available. So in development is a resource tool that outlines how Indigenous people can access PrEP in BC. Sex Ed is Our Right is another project that we've been working on a lot over the last 2 years. This is our Safer Schools campaign, and so maybe some of you might be wondering, like, what is the connection between Safer Schools or Sex Ed and the work that we do? And so the thought here is that HIV education intervention happening at a youth level is very impactful and meaningful when it comes to HIV prevention and treatment and care. So we launched this campaign last year with YouthGo, and we've been working on it throughout 2019. YouthGo last year published a peer-led report based on what LGBTQ youth were currently feeling about sex ed that they were getting in schools, and the report found that overall LGBTQ youth were not satisfied with the sexual health information that they were getting in classrooms, and that they want a sexual health education that's relevant and inclusive to them. So now we're at the point where we're doing our final pushes for this campaign. With YouthGo, we're going to be doing a mass mail-out of Sex Ed is Our Right packages to all of the high schools in BC, and that's happening sometime before the end of this month. Well, yes, because it's November now. So we're putting together and sending out packages to all the high schools in BC, including schools that are kindergarten to 12, basically to ensure that we're reaching all the schools that have students grade 10, 11, and 12. And in these packages that we're sending out, we're including a one-page summary of the peer-led report that YouthCo developed, where we interviewed youth from all over BC. We're including a 6-page excerpt from the Canadian Guidelines for Sexual Health Education that was produced by CCAN, the Sex Information and Education Council of Canada, and we're including the 6 pages that outline what are the core principles to comprehensive sexual health education that are relevant to LGBTQ students. We're also including in our mail-out packages like a pre-written postcards that teachers can send to their MLA to ask for better sex ed resources for when they have to teach sex ed. Okay, so recently, and so at this point you're wondering, like, Darren, you've been talking for a long time. Why is Kiarmin just standing here? So recently, I will tell you why. Recently, CBRC has been partnering with Health Initiative for Men, and we've launched a new campaign to promote combination prevention a few months ago. It's called checkyourself.today, not .com, because we wanted to stress the urgency of now. So the website is checkyourself.today. The campaign was developed under the premise that in BC, we currently have a lot of sexual health tools, and we want gbMSM to consider all of these tools as part of their sexual health strategy. But we also know that sometimes when there's so many options, it can get overwhelming. So we thought having our options laid out on a checklist would help with that, and we wanted to get these tools into the hands of gbMSM in BC. I'll let Carmen speak more.
Thank you, Darren. Yeah, so Check Yourself today is a sort of a service map program map that provides GBT2Q with a helpful list of sexual health tools currently available in BC, as well as accurate and up-to-date information regarding each tool. It has information on combination prevention tools like HPV vaccines, Hep vaccines, testing, condoms, PEP and PrEP, HIV medication, and with the help of a clinic database of our partners at the Smart Sex Resource. This website also includes a map of over 150 sexual health clinics across BC, which users can filter based on the availability of each tool you are seeking. This means that checkyourself.today also hosts the first online directory clinics in BC that offers PrEP referrals or can prescribe PrEP. And this is largely due to the work of our community trainees at HIM, Louis and Malachi. Where are you? Okay, there you are. Who have been fantastic in the data collection and in some knowledge exchange process of this project. So the process included creating a script with questions to ask the clinics that we called, and we called over, and when I say we, I mean mostly Louis and Malachi, called over 187 clinics across BC and spoke with over 150 healthcare service providers. And in this script, we also had a fact sheet and information about PrEP and combination prevention tools. And these conversations with healthcare service providers were a chance for us to educate them and exchange some knowledge on the latest updates about combination prevention access in BC. Information about PrEP was specifically well received, especially in the interior region, with some service providers expressing their interest to look into PrEP pathways and PrEP prescription in their regions where the pathways were not so clear. We have Also collected addresses that we will mail some clinics packages, which include Check Yourself promo, as well as a PrEP toolkit, and that is a step-by-step how to access PrEP called PrEP Step by Step, developed by CBRC. And lastly, I want to mention that Check Yourself is a useful inventory tool that is now linked on sexual health tools section on HIM's website, along with Tell Your Partners, which is a tool that allows anyone to notify their sexual partners anonymously if they have an STI and their partner should get tested and treatment. It is as simple as entering a number or an email address, and you can also use it. You can use any Canadian phone number, so you can be used outside of BC. The other tool is your sexual health calculator, a tool that, based on a person's sexual behavior, suggests what combination prevention strategies are best for them to take care of their sexual health. So by combining these three services, we hope to make taking care of sexual health efficient and accessible, something that can be daunting and intimidating at first. That's you.
Yes, thanks. So I'll just briefly talk about what's next for the gbMSM Health Network. We're working with Travis Sawe at BC CDC on an LGBTQ mental health service map directory called MindMap. Maybe by this time next year we'll be able to, or I guess Travis already presented that this year, or announced it. We're also working on a program called Pivot, which is a systems and policy change intervention program. We're working to get more testing options for gbMSM in the interior, northern, and island regions, and we're working on strengthening our relationships with Indigenous and Two-Spirit partners. And lastly, we're building further connections with gbMSM frontline workers in underserved BC regions. Thanks.